Hello everybody. In this video we are going to talk about the nasal bone fractures. Nasal bones are like a steeped roof like that. Now whenever there is a fracture of the nasal bone, the bridge either collapses or one side bone goes down like this and the other is holding. So there's a deformity. The nose, there's a deformity, obvious deformity. It can be pushed to one side, it can collapse completely. Now we all know that a simple injury to the nose causes a lot of bleeding. So how do we correct this nasal bone fractures? What we do is we bring the bone back to its original position and we give a support from underneath so that the triangle stays as such. So that is what we do. Now to do this, we have to admit the patient and do it only under general anesthesia. We cannot do it under local anesthesia or as an outpatient procedure. We have to admit the patient, we have to do it under general anesthesia. Now after doing that, we have to pack the nostrils. And this serves two purposes. One is to give a support so that the reduction is maintained, and two, it stops the bleeding from the nose because we have packed it and the bleeding stops. Now how long do we keep the pack inside? We keep the pack inside for 48 hours. So after 48 hours, we gently remove the pack and see if there's any fresh bleeding. If there's no fresh bleeding, we ask the patient to stay in bed for a few hours, then slowly get up and then walk, and if there's no bleeding, we can discharge the patient. So the patient has to stay in the hospital for a minimum period of 2 to 3 days. Now in this illustrative case that I'm showing you, you can now see that the nose has been broken, it is deformed, and in the post-op period, we can see that the correction has been done. The patient is very happy with the result. This is to just give an idea about a nasal bone fracture and how it is treated and how it is corrected and what are the results pre-operative and post-operative. Thank you for watching this video. We'll meet again. Thank you.